Hi, I'm Kathryn Anderson, APPI Master Trainer. Today I'm going to show you the leg pull-in prone prep exercise as part of the APPI repertoire on behalf of Unite Health. So we have Molly here. He's going to demonstrate the exercise and you can see she's in all fours. Now, one thing I really like about this exercise is it gives us a great opportunity to train the deep neck flexors and the scapular stabilizers against gravity. So it works really well for desk workers and those who have to sit and use their shoulders for long periods. In addition to that, and this is something that's overlooked in 4-point kneeling, it gives us a really good opportunity to train the angle of the hip at 90 degrees, which transfers over really well in functional movements such as sitting and riding your bike. So the setup of the exercise, we're starting in all fours, and are you ready, Molly? I'm just going to cue you through your chest to lift just a little bit through the breastbone. Now, the reason I do this is to get a nice, wide, broad scapula, so the scapula are really congruent through the chest wall. From there, we get the neck into position, and to do this, I like to imagine that you're projecting out through the crown of your head, almost like you're wearing a swimming cap, and you're projecting your head through the water where this is the path of least resistance. Now, what this does is it makes sure you've got the deep neck flexors on and stops you from using the erector spinae or the spinal extensors, which you can sometimes see overwork on the back of the neck. Now, of course, most importantly and often forgot is the position of the pelvis in 4-point kneeling. So you want to make sure there's a little lift of the rib cage and then a little bit of extension through the tailbone. So just kicking up the lower back using the multifidus muscle. From there, Molly, I'm going to get you to tuck your toes underneath you. Take a breath in, and as you breathe out, you're going to lift up. You'll hold for an inhalation, and then as you exhale, you'll release. Inhale to check your setting, exhale to lift, inhale to hold, and exhale to release. Now, one clinical tip that I'll give you is that you can use this exercise to assess the endurance of the deep neck flexors and the scapular stabilizers. The way that I tend to do it is do a longer hold. So Molly, next time as you're ready, I'll get you to set your scapula, nice length through the back of your neck, tailbone up, and lift up your knees. And then you're going to hold for about 15 or 20 seconds. As you do this, continue to breathe as per normal, those nice big long volumes, and we're going to assess what the person feels like when they're here. We want to make sure their tailbone stays up, and if that happens, then they should feel their core rather than their quads. They're going to make sure they get that nice scapular lift just so that you get that nice congruency through the serratus anterior, and of course that nice projection out. Okay, you can have a little rest there, Molly. So I hope that gives you some nice teaching tips on this exercise. Really, really important and great for those who need to sit and do desk work. Thanks for watching.